I thought that I would, this virus, patients of this virus live by the day. So I'm going to take you through my days. I'm on day 44 right now. And my doctors take a diary every day. And then they send it to the CDC to collect data. And so I've lived my life for 44 days by the day. So I just figured that would be my easiest way to relay what has happened to me. So on March 19th, 20th, I started getting a tickle in my throat. And I kind of had a feeling that I might have it. I don't know why, I just was overly paranoid. So so that was probably like March 19th. And by March 21st, I was completely lifeless in bed. And so what they do is they start counting by that day. So they don't count by the tickle in my throat. They count day one as the day I woke up and I was lifeless. I had a hard time breathing. I had a fever. I had a asthmatic cough, very dry cough, which is very different than the flu cough. The flu cough is very wet and phlegmy. Mine was very dry. I had a headache, no appetite, and literally could not walk to the bathroom. Day one, I slept all day and just drank water. I was very thirsty. I'm still always very thirsty. I drink, so this is a 32 ounce. I drink 3 of these a day, and I'm still thirsty. So day one, I knew I had it. I texted Florence because she was still in bed, and I said, take a deep breath, don't worry, I'm going to be okay, but I think I have it. I said, don't come in my room, and then I texted her the plan because I couldn't talk. So we set up a plan through texting on how she's going to stay away from me and how she's going to take care of the house and take care of herself and everything. So the first day, pretty much I just slept, and she would bring me soup. I barely ate any of it. By day 4, 5, I had a little bit more energy, not a lot. By day 5, everything I smelled or tasted like rotten metal, which I know sounds weird, but it had a metal taste and it tasted rotten. So nothing tasted good. I couldn't stomach anything. I had major diarrhea. I smelled smoke all day long. Like I thought the house was on fire. I kept saying, is the wood stove okay? And because I just kept smelling fire. It was very bizarre. By day 5, I had already been in touch with my doctor. Monadnock had already set up a COVID center in New Ipswich, completely off-site from Monadnock. They were filtering anybody that had any symptom over to New Ipswich. When I said to them, I feel like I have asthma, I feel like I can't breathe, and I have a dry cough, they knew right away because everybody else was saying the same thing. So Florence brought me over to the COVID clinic. And when you drive in, you're supposed to park in front of the side doorway and call and say that you're there. You wait about 10 minutes and the doctor comes out in full on PPE. She's got her uniform, she's got her shield, she has 2 masks on, glasses, you name it. And you're instructed to crack your window that much. And they sort of like throw a mask through the crack in the window, and you put the mask on. And then I shuffled down the hallway into the room. The room was all set up with microphones covered in plastic, and all the nurses were hidden behind closed doors. The doctor tried not to touch me. I sort of had to like get in there on my own. I sat down and she just went through everything, like my history and all my symptoms. She did not touch me. She stood back from me. I could only see her eyes. That was it on her whole body. Her hair was covered. Everything was covered. They took my temperature and checked my she checked my vitals, and she said, Kirsten, we have no test kits. I can't test you. And I was like, oh, geez. She goes, I can pretty much 99.9% tell you that you have it. This is what I want you to do. I want you to go home. We're going to set up your house like the ER. You're not allowed to go to the hospital. I checked your lungs seem fine. We are going to check in with you every day. We're going to take the diary of what your symptoms are, how you're feeling, so that we can share it with the governor, the CDC, and all the other health organizations. She says, we don't know much. I can't tell you a lot. This is all new to us, and we're learning something new every day. Dr. McClintock, that was my first doctor, she's on a call 3 times a day with the government, learning and getting new data 3 times a day, every single day. So I went home and kept pushing fluids. She did say to me, you should start to get better by day 14. So by day 10, wasn't getting better. Day 11, no better. Day 14, by this time, they were a little baffled, but they were learning more information. They started seeing that people started doing a decline on day 8, 9, and 10. I had made it to day 14, and I called and said, I feel horrible. I'm no better. So so Florence drove me to the hospital. They have set up an X-ray room, and it's on the side of the ambulance entrance, and it's like a storage closet that they converted into an X-ray room. It was fabulous. They wheel you in. You literally go into this room 2 feet. You don't even have time to hold your breath. They're like, okay, hold your breath. And they click, and then they zoom you right out. Everything was covered in plastic. Everyone's behind a plastic wall. And the man that came out to get me is completely covered. You can't see anything but his eyes. Once I got my x-rays back, it showed that I had pneumonia. At that point, Dr. Cooley had set up a brilliant idea. She set up the paramedic department at Monadnock to be visiting nurses for COVID patients, and to have that little lifeline over the weekend, because you never know when you're going to decline and what day you're going to decline. And I was day 14, I wasn't getting any better, and now I have pneumonia. So Dr. Cooley set up this paramedic program to go and visit COVID patients in their home, and that was the ER idea that they were talking about. So the next day, Josh, the paramedic, came to my house. He said, I will call you when I get there. It's going to take me 25 minutes to suit up. I was like, okay, I wonder what that means. So Josh showed up day 15 and came with a big van, and he literally put on a hazmat suit, head to toe, and an oxygen tank in the back. And it pumped in oxygen into this mask that was all around his head and face. But there were little, it's like elastic bands here that he could put over his ears so that he could use a stethoscope. But other than that, he was in this hazmat suit. And he had put tape around his wrists and his ankles. And he came in with everything imaginable, all of these cases full of everything. He drew my blood, he took my vitals. The first thing I noticed besides the hazmat suit and the oxygen tank was, it'll make me cry, he was shaking. His hands were just shaking like a leaf. I knew he was scared, and I was scared for him. And, you know, I didn't touch him. I wore a mask and I just said, thank you, Josh. And he was so like, oh, no problem. I'm so happy to be here. And God bless him. His hands were just shaking a mile a minute. So that was wonderful having Josh come to my house. He came to my house several times, and the more he came, the less his hands shook. That was a wonderful program, and I commend Monadnock for setting that up. By day 18, I was getting a little bit better. I actually woke up with some energy. My breathing was better. My appetite was better. And I actually said, maybe I'll do some laundry. So I did laundry. I checked it with my doctor, and she said, this virus is so scary because you feel good today, Kirsten, but stay in bed. Don't do anything. Don't do laundry. I know you want to, but it's going to come and kick you tomorrow. And I was like, well, I think I'm on the mends. And she's like, okay, just take it easy. Day 19 came back and kicked me in the ass. I was down again. All my symptoms came back. By day 20, I started getting dizzy and I started getting confused, which are more symptoms of COVID. The dizziness stayed for like a week. Some days it would get so bad that I could just sit there. I did not have the bed spins. It's very different than that. It's just everything is dizzy in your head. And I couldn't find the words to finish sentences. That went away. It lasted for about a week, so that would be day 25. By day 25, they redid my x-ray because I wasn't getting better. But the x-ray showed that my pneumonia was gone, so that's good. I did a lot of breathing exercises to get my lungs going because I didn't want to get worse with that. Day 30 hit, and I noticed that the virus not only takes a physical toll on your body, but it takes an emotional toll. I started breaking down more. I started crying more. I started praying more. I started thinking, is this going to be my life from now on? I'm a runner, a hiker, a pescatarian. I don't smoke. I don't drink. This is a whole new world for me. And so I started thinking, I think somewhere around there, I put this on Facebook because I started seeing people posting, and they're out and they're playing tennis and they're out doing everything they can. And I thought to myself, I'm day 30 and I'm still fighting this virus, and it's serious. And if I can catch it, anybody can catch it. By day 30, Dr. McClintock, Dr. Cooley, no more. So they're feeding me as much information as they can. My girlfriend's husband runs UCSF, and so he had his colleague, who's an infectious disease doctor, call me, Dr. Babick, amazing woman. One of my heroes for actually reaching out to me. I started talking to her daily. She had a lot of information. She's the one that told me about the monkey that they are testing. The monkey got reinfected within 3 weeks. And she said that they are testing the live and the dead cells, but they don't have the technology and they don't have the correct chemicals in order to test them properly. So they're scrambling to get the technology and the chemicals to be able to test the live and dead cells. So she told me that the CDC says that after you are symptom-free for 3 days, wait 72 hours and you can go out. She told me absolutely not. She's like, we don't know enough about this virus. The monkey got reinfected. She's like, Kirsten, I want you to be 3 days symptom-free, and then I want you to wait a month before you go out, because I don't know if you can infect somebody, and I don't know if you can get it again. She also told me about the masks that canvas, denim, paper towels, bed linens that are 200 thread count and more are the only materials right now that are worth wearing if you can't get an N95. Because she said that the virus cell they have discovered is a different size in water than it is in air. And because canvas and denim are so thick and the cotton fibers are rough, it'll catch the different size particles of the virus, whether it's in like a water droplet or if it's in the air. She did tell me to calm down about Florence, because Florence has, she's healthy, she's fine. She said 99% of 18-year-olds and younger will be asymptomatic or will not get it. So that really helped me throughout this journey, not having to worry about Florence, because I was worried about who's going to take care of her if I can't even take care of myself. Day 35, I was getting better, had some more energy. My sore throat went away, but I still have a constant pain in this gland right here that radiates up into my ear sometimes. And I still have my breathing. And I don't really have a big appetite. But the smell, my smell's back, my taste is back for the most part. I still get dizzy sometimes. I'm still tired, but still sleeping a lot. I don't take naps anymore. I'm day 44 right now, and for 44 days, well, let's say for 41 days, I've had a fever. Whether it's low grade or high grade, I've had a fever every day. One big thing that Jen Babick and I talked about, Dr. Babick, when these restrictions in our country are lifted and they're putting in place taking your temperature, we both kind of laughed about that, and Balmeet and I laughed about it today. I never know when I'm going to have my fever. My fever could spike randomly. There is no rhyme or reason. It could be 99.2, it could be 100.4. If you're going to a place that is taking temperatures and nothing else, it's not safe, because you never know when you're going to spike a fever. So it's one of my big sticking points, because I just think there needs to be other precautions put in place. I still have not gone out of the house. Florence and I have driven around once of Dublin because I wanted to see, get out and see Dublin. I have done healing meditations every day religiously. I have prayed every day religiously. I started eating immune boosting foods, and not that I didn't before, but because I didn't eat for 2 weeks, I started eating raw garlic, raw mushrooms, raw broccoli, raw pomegranate, you name it, anything I could research about immunity boosting foods. I've been eating it because my immune system is shot, and Dr. Cooley doesn't want me to get a second infection. So we're still washing hands. We're still washing all of our groceries that come into the house. But I'm pretty much staying home and not going anywhere, obviously. I did start back at work last week. It has been hard only because I don't have the energy. But so today I'm day 45, and I do have a low-grade fever right now. I didn't have one all day, but I started having one about an hour and a half ago. I think some of the things that saved me throughout my 44 days is an O2 reader. I think everyone should buy an O2 reader. They're cheap. They're like $32. I think everyone should have a blood pressure cuff. And a really good ear thermometer. Dr. McClintock, Dr. Cooley, they're all like, what kind of thermometer do you have? I'm like, I have an ear. So they're like, good, get an ear one, have an ear one. I literally lived with the O2 meter on my finger every day, all day, to check my O2 level. That gave me peace of mind. Because some days, it's in the 90s, and so I'm good if it's in the 90s, and that made me calm down. I took my blood pressure. I took my pulse. And so I would chart all of this and relay it to my doctor. That really helped a lot. My girlfriend's husband's a pilot. They are required to have an O2 reader with them. He's furloughed. He gave me his. Bless his heart. That really helped me. In the middle of the night when I couldn't breathe, I would roll over and put the O2 on my finger, and if it came out in the 90s, I was like, okay, I can go try to go to sleep. So they don't know why I still have it. They don't know why it's still presenting symptoms in my body. Right now, I'm just taking one day at a time and doing my best. I hope I've covered everything. A big shout out to Monadnock. Oh, I do know one thing. That was another stickler. Dr. McClintock, on my second time that I saw her, she said, Kirsten, please get the word out that to ignore the numbers. The numbers are not true. Monadnock did not have a lot of test kits. And that's why I put a lot of that in my post. They didn't have the test kits. They were out of the nasal kits for 2 weeks, which means they could only rely on the mouth kit, the mouth swab. And the mouth swab has a 40% fail rate. The nasal swab, which is not a swab, it goes all the way back into your brain practically. It hurts like hell. That is a 15% to a 20% fail rate. The CDC and the government will not count a false negative. And the CDC and the government will not count somebody who hasn't had a test. And so when I went in the first time, they were out of test kits. They couldn't test me. And so the second time, she's like, you got to tell everybody, stop listening to these numbers, times it by 4. And Balmeet and I were talking today, it was like, it's probably times 10. She said the COVID clinic in New Hampshire was slammed in New Ipswich, with cases that they could not tell the CDC. They told the governor, but the governor couldn't even report it because they are only reporting confirmed cases. So when you see New Hampshire numbers, times it by 4 or times it by 5. It's here, it's out there. Dr. Jen Babbitt told me that 6 feet is definitely not far enough. It should be 12 feet with a mask on because it lasts 3 hours in the air. She said 6 feet is just not enough. We're kidding ourselves. I'm trying to think what else. She did say that it helped that Jen Babbitt said, thank God you're a runner because your blood vessels are good and your lungs are good. So thank God you exercise every day. And she said, I wish more people, hopefully more people will start to exercise and keep themselves healthy because my case could have been so much worse if I were not a runner and I were not a non-smoker and I didn't eat as healthy. I do have some autoimmune, tiny ones. I have rosacea and I have Raynaud's, but they don't think that's a contributing factor since it's not they're not big like, here I go, my COVID brain, rheumatoid arthritis. It's not that type of autoimmune, but I still have not had any sugar because it's an inflammatory and no dairy because that's an inflammatory. So I'm doing everything I can to get better. And right now it's just time, I think, hopefully praying, that's just time. So do you all have any questions?
One came in on the chat just a minute ago. Your friend Kathy said, where do you think you picked it up?
So there's a 2 to 14 day incubation period. Florence and I were scheduled to fly to South Carolina. I canceled that and decided to drive thinking it would be safer. So before we left on Saturday, the 14th or the 15th, I was in Keene, I was in Peterborough, and I was in Dublin. I worked with a ton of people in Keene. I was in a big bullpen with probably 100 people. I was in meetings all day with tons of people. I started getting my symptoms 4 days after I left. So I could have gotten it in Keene or I could have gotten it in Charleston, South Carolina. But when we were in Charleston, we did a self-guided tour at the College of Charleston. Nobody was around. It was just the 2 of us. We didn't go out to eat. We did takeout. We didn't touch anything unless we had a Clorox wipe in our hand. We Cloroxed down the hotel room, like literally Cloroxed everything in the hotel room. We didn't leave our hotel room. And after we did our tour, we drove to Florida and did the same thing, Clorox wipes. But I had started getting a tickle in my throat by Florida. So I think it was either Keene or Dublin or Charleston.
Kirsten, did they have you do any contact tracing?
They did not, which I was surprised. They did not. Obviously, Florence. I didn't know anybody in Charleston, and when we were in Florida, we went around University of Tampa by ourselves. Nobody was there. And then we went to the beach a half a day and sat. Nobody was really at the small beach where we were, and we sat by ourselves. And when I was in the hotel lobby, I stood far away from the person checking us in. And since I travel for work, I had already, used my app to prepay, to sign in. All I had to do was pick up my key, which they leave for me. And so I wasn't really near anybody. Nobody was in a lot of the hotels. So yeah, I don't know.
Mhm. I'm so grateful that you're willing to share this and that your voice is holding out. So I am amazed. I do want to let people know. So I didn't mention this. I'm in my barn at home, and I just noticed that my husband chimed in. He's in the house. He's, for those of you with screens. So he is an emergency room physician, and he's willing to take questions too. So are there questions? So if you're not familiar with Zoom, if you open your participant list, you can see at the bottom of the list, there are two little buttons. One on the left-hand side says mute me, and another one says raise hand. So if you raise your hand, that'll trigger in the corner of your screen. I just did it for me so that people can see my hand is raised. So please feel free to ask your questions. This is where I'd be running around with the microphone right now.
Right.
Like.
Dave Mueller raised his hand. Let's see. Go ahead and unmute yourself, Dave. Oh, there you are.
Yeah.
Go ahead.
So I haven't watched the ticker numbers for the last day or two, but have you not officially been tested? Is that's why there's never Dublin in that running ticker of what towns have a COVID case?
So I was tested when Josh came, which was day 15. He did a mouth swab. It came back negative. It was day 15, and it was a mouth swab. And my Dr. McClintock said, I'm almost positive it's a false negative. I have recently, so I went back to the COVID center Friday because I felt like shit. Like I just felt horrible, and I was getting scared for the weekend. So they did an antibody test on me Friday in the office. So that takes 3 to 5 days to come back. So once I get that, it'll show that I have the antibodies. And Dr. McClintock and Dr. Cooley are urging people that do have it to donate blood because they need it for the vaccine. So if you know someone who has it, let them know that they need their blood.
So Eric, would you be willing to speak to a little bit about the numbers?
I'm sorry, to what?
To the numbers. So Dennis just asked, he said he hasn't seen any numbers from Dublin, and I hear that a lot from other people, is that, oh, there's no numbers in Cheshire, there's no numbers in, fill in the blank. Do you want to speak to that a little bit?
Yeah, it's just they were so good. No, I think the main issue is that we're not doing nearly enough testing. We're not allowing people who have a clinical, a high clinical suspicion of having it being diagnosed by their primary care physician. That should be counting. The state is running tests, but there are private companies, Quest, Dartmouth Hitchcock Catholic Medical Center now has a testing site. I don't know if they're counting all those. There just seems to be this concerted effort, number one, not to test, and number two, to minimize the numbers out there. And it's mind-boggling to me how non-open we have been institutionally about this. This is something that is just, most of the docs that I'm with just cannot really understand our epidemiological response to this. This is just, it's not changing. It's very frustrating that it's just not, after 2 months, 3 months of this, we haven't changed our tune.
Yeah.
But I agree, I think it is many-fold higher than the numbers suggest.
Yeah. And I think that's, and to Eric's point, that's why Dr. McClintock was like, get the word out. Like,
Yeah.
people don't realize how how these numbers are false, and it's so much greater than what is out there. So I agree. So stay home. Stay home.
We had a question in the chat from Catherine asking, are you taking high doses of vitamin C?
I am not taking high doses, but I eat my orange a day, and I do take a shit ton of vitamin C, but not high doses. But yes, so I am taking my Pepsid, I am taking my vitamin C, I am trying anything and everything I can.
Right.
To help this, but I'm probably taking 2,000 milligrams of vitamin C. I don't know if that's high dose, Eric.
Yeah.
I don't think it is, but I don't know if it's helping or not.
Yeah. And we have a hand from Kathy, so I'll unmute her. Kathy, go ahead.
Hi, Kirsten. It's actually
Hi.
So I have a question about the antibodies. They're testing antibodies, and there is a big push for it. I'm a dentist, and my staff, before we go in, they want everybody tested for everything. And I've heard that just because you have the antibodies, you're not immune, and there's reports of people that are getting this again. I mean, it doesn't seem like you've ever gotten 100% better yet, Kirsten. So that's just a sign of, okay, how potent this virus is. So can either you or the doctor say anything about that?
Well, what I learned from Dr. Babick, infectious disease doctor at UCSF, she said that they do not know yet if you can get reinfected. The monkey that they're testing got reinfected within 3 weeks. And she said, and at the time when we were talking about the monkey, she said, wait, Kirsten, because I'll let you know as weeks go on what happens to the monkey. And that's why she said to me, do not go out of your house. Wait the 3 days that you're symptom free, and then wait the 3 to 4 weeks to go out, because you could get reinfected. We do not know yet. I don't know if Eric knows more. This was a couple weeks ago. Eric may know more.
I don't. I just saw a couple news reports, one out of South Korea, one out of China, that says definitively you can't get reinfected just in the last day or two. But I mean, the anecdotal stuff is people getting reinfected. I don't think there's a definite answer. I wouldn't take a chance right now.
Yeah, I'm not. I'll Zoom with you guys for the next year.
We'll let you.
So I have a question for the both of you. It's about wearing masks. So if you have been exposed, but you either don't have it or you're asymptomatic, and you're outside, maybe just going for a walk or something, should you be wearing a mask? What's the general feeling on that? I mean, obviously, I think the rule of thumb now, whether you're resistant to it or not, is that if you are going into a store or something, everybody's wearing a mask. But what about if you're out for a walk or something?
Right. I mean, outdoors safer than indoors. There's more disbursement. There's more wind. If you're just walking by yourself, you don't need to wear a mask. But if you're coming upon people, I would say, yeah, protect yourself and protect other people. No one knows what you're breathing out. Again, if you're not wearing a respirator or some big protection, you will have less protection, but you'll have something. But certainly, it's going to be very good, say for Kirsten, to be wearing a mask if she's out and about, so that she's not releasing any, dumping any viral particles out of her mouth, or it's just getting stuck on her mask.
Yeah.
And I agree, the safest thing is the respirator, because that will block the passage of the micron-sized particles.
Yeah.
And so is the assumption that Florence are they assuming that she's positive and asymptomatic, or are they just not checking her because there are no symptoms?
Yeah, they refused to test her. because they didn't want to waste a test kit on her. I have no idea. She sneezed once in the past 44 days. She had a little bit of a runny nose one day. They think Jen Babick, she's like, I don't think she got it. She's like 99% of 18-year-olds and younger will be asymptomatic or will not get it. She's like, and if she got it, maybe it was the sneeze. But I will have her tested for the antibodies just so that we know.
That brings up the question came up through the chat from Sarah. She says, is the antibody test accurate?
There are, Dr. Cooley told me Friday, like any test, there are false positives and false negatives.
Mm-hmm. Okay. Satpur just says, people in stores are not wearing masks, and I call greengrocers saying that I would not be shopping there because they are not suggesting masks for shoppers, nor are they limiting the number of people in the store. Any comment about that?
Yeah, don't go.
Yeah, that's a rough store because it's not very, the aisles aren't very wide either. They do have a curbside pickup, but it usually takes a few days to a week to get your, delivery or whatever, your delivery ready.
But they just sent out an announcement yesterday that they were going to be wearing masks and doing online ordering. So I don't know which is true.
They have a great online system, but you have to sign up for a curbside pickup, and there's only a certain number of slots available. And so once those get used up, then you get pushed out a few days.
Right.
They're doing better. I'll give them kudos. They're really trying to make it work there, but they're challenged with the space.
Yep.
I think that's, Balmeet and I are talking about this afternoon. It's very frustrating to see people not wearing a mask. It's such a simple thing to do. If you need one, my mom is making them, I'll get you one. But people really, our lives have changed forever. We are not going back to whatever you think normal was. We're not. And so we need to really start embracing the change. And right now, with the numbers not being real, you really need to protect yourself and to protect your family and wear a mask wherever you go.
Right. That brings up another question that just came up from Margaret. Do you have any advice for children and play dates? Don't
do them. So a lot of my friends were still doing play dates. When I was day 16, 17, I still had friends that were putting together play dates, and it absolutely infuriated me because you don't know where their parents went, and they don't know where you went, and kids are carriers, and they're silent carriers. And so, no, this is the time to teach your child resilience. This is the time to stay home and embrace that beautiful child of yours and come up with some creative, fun, loving things to do. They will live without seeing their friends, and they will keep their parents alive. God forbid they get their friends' parents sick.
The
Children are carriers.
The discussion about reopening schools because kids can't get infected easily just makes no sense, because are you just going to keep them in the schools? I mean, they're going to bring it home. They're going to get their parents infected, and it just hasn't been thought through.
Right.
No, hasn't been. Yeah, it's absolutely insane. Do not just keep your kids at home, and they will be better human beings because of it, because they'll learn new skills like resilience that they need to get through life.
Kirsten, yeah, go ahead.
Hi. So shameless plug, I sell masks that are 400 count lined and denim on the outside. So
awesome.
I'll put my Etsy in the comments there if anyone wants. Kirsten, thank you so much for your story. For me, it really hit home. You're about my age and very healthy. And I thought, whoa, it's very eye-opening to hear your story, and also at this point, like right where we are right now, I feel like we have like quarantine fatigue.
Yes.
You know, like I see it. I drove by. I live in Keene, and there was a college party.
You're kidding.
No, I am not kidding. And I called the police because I just feel like that's that important. And they said it's not a mandated, it's simply a recommendation. So they're not doing anything about it. It's just kind of shocking. I don't know. And so I guess what I'm saying is I think people are sick of being pent up, and especially college age kids. And that's like, they're on their own journey with it all, but it is frightening. And I don't know. So thank you. I just wanted to thank you for.
I need to jump in. It looks like Susan must have hit the share screen button. If you could unshare your screen, because right now we're looking at your Zoom.
Oh, that's what happened. Thank you.
Oh, I was wondering what happened. I was like,
I don't know where I am.
You
Susan,
were viewing
are you there?
Susan. Oh, Susan hit her.
Is that Susan Stover, I think?
Hey, I also want to thank you, Kirsten, for sharing your story. I just think it's so important to have this firsthand knowledge from someone that has actually experienced this, instead of the rumors and the sort of hearsay that is all floating around social media. And I'm going to do another shameless plug, but we are not selling masks. I feel really strongly that we need to also provide more masks for our community. So I'm working with a bunch of different mask makers all over the state. So if you are into making masks and making them for free for the better of our community, we are setting up kiosks or racks at different places. So we'll have a listing that like includes the Dublin rack, and we'll hopefully recruit more people to fill those racks, and maybe come up with some kits and things so that people could make their own at home. And we're working with the makerspace in Peterborough to cut large stacks of fabrics with a laser cutter and have a drop-off place there. So I'd love to talk to you more at some point offline about materials and things, because right now I think we're all using what we have at home. But as we get sort of better and refine our craft, I feel like we want to really come up with some designs that work for people.
And if you could send me any information, I can put it out on the Hubbub newsletter as well.
Yeah.
Cool. Thank you, Volkert.
Yeah.
And just make sure it's over 200 thread count.
Yeah, that's good to know.
For canvas, denim, paper towels, which is, I think is funny.
Yeah, I've been working with Roy at the Makerspace because there's also some information about the electrostatic element. So we're gonna try to figure some stuff out together and see what we can come up with. So
awesome.
Well, we promised Kirsten to keep this under an hour. So are there any last minute questions? We have about 4 minutes left before we want to shut down. Any last questions? Balmeet, any last words from you?
Thank you all for coming. I had no idea how this was going to go, and it's amazing that you all showed up. If you have any other topics that you would like the community center to host, please let us know. As you know, the physical facility is shut down, except for we have a rack outside front with masks available. And Wi-Fi is available if you're in your car. So that's, Volkert has that posted on the website. And if you want to get on he sends out an amazing newsletter every Sunday evening from the community center. So let us know your email if you want to get included on that. And we're totally okay if you want to sit in your car outside and use the hub Wi-Fi. Maybe you're in your car and you need to have a meeting. That's a great place to go. It is in the center of town, so reception. And we're having a lunch, a free takeout lunch on May 14th. So let me see if I can remember the menu. It's a tomato soup and rolls and a cookie and some fruit salad. And we're gonna have them packaged in bags to go. You drive up, and we're gonna have if it's raining, we'll have an outdoor pop-up tent, so you can roll down your window and take a lunch or two and go on home and eat. So that's to replace our monthly, we've always done a monthly community lunch. So, and another request is, if you know people, you know, it's always, we want to serve everybody, but it's always a little delicate to find who's actually really in need. You know, Yankees, we don't like to complain too loudly. We don't like to let people know when we need anything, but now's not the time to be shy. So if you know anybody who's in need, please let us know, and we have a list of volunteers who are willing to help with the capacity of things. And if we don't have that on our list, we'll put it on our list. So we want to make sure that people are taken care of. So we're here to serve. So please let us know.
Very good. So let's all give Kirsten a big hand.
Thank you.
Thank you, Kirsten, so much for joining us tonight. Thank you, Balmeet,
Thank
for
you
hosting.
all.
This
Thank
was
you
very
all.
informative and very
It takes
helpful.
it takes a village. It definitely takes
It
a village.
does. And Dublin's a great village. So thank you all for
Yes.
coming, and we'll do this again sometime.
Thank you. Take care, Kirsten.
Thank you.
Goodbye.
Everyone.
Bye, everybody.
Thank you.
Bye.
Thank you.
Bye-bye.